Hi everyone, happy Friday. Hope you're doing well and hope that your week is coming to a nice close. Today on the Instagram Live, we're going to be talking about insurance coverage and open enrollment that's coming up in 1 month. It starts November 1st, and this is an opportunity to enroll in an insurance plan through the Affordable Care Act, also known as Obamacare, also known as the ACA. They're all referring to the same thing. So we're just going to get Whitman-Walker on stage and then get started. All right. In the interim, if you need to access HIV or STI testing, please give Whitman-Walker a call at 202-797-4439. You can schedule an appointment for HIV or STI testing at their Max Robinson Center or their 1525 14th Street Northwest location. Hello, Whitman-Walker. Thanks for joining. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platform. We cover various topics about HIV and STIs, to sexual health practices and access to care, to social determinants of health and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and today we're going to discuss open enrollment and getting insurance coverage. So open enrollment is a period at the end of the year where people and small businesses can enroll in insurance coverage through the insurance marketplace. The open enrollment period traditionally starts on November 1st each year and goes for a limited time. It is coming up in 1 month, again on November 1st, but enrollment deadlines vary by state, as do available insurance plans. They also vary by state. But the goal is to generally make sure that you've got coverage that starts January 1st of the following calendar year. So in this case, January 1st, 2023. Depending on where you live, you may be able to enroll during one of the tiered deadline periods that starts coverage later in the year, like on February 1st or March 1st. Please note that if you are receiving healthcare coverage through your employer or one of the public options of Medicaid or Medicare, all of this talk about open enrollment does not apply to you. But also everyone knows that the language and the terms used in healthcare and the medical space can be confusing. And then you add the conversation about insurance. So if you need help getting familiar with terms as it relates to insurance and coverage and deductibles, visit healthcare.gov/glossary for terms and definitions. So just so you know, Whitman-Walker has insurance navigation help available. Their insurance navigation team is here to speak with folks about health insurance options and any problems that they may be having with their insurance or the cost of their care. They help both patients and non-patients who live in the DC, Maryland, and Virginia area, and their goal is to help you find the best health insurance for your care needs and to make the amount that you pay for your health care more affordable. So you can give them a call at 202-745-6151. Again, that's 202-745-6151 for help with your insurance coverage and cost of care, and just making sure that you're enrolled in the best plan that meets your needs while also maintaining an affordable price point. So let's back up a bit about how the Affordable Care Act, also known as the ACA, also known as Obamacare, came into be. It's also known as the marketplace, but basically this change was enacted in 2010 under the Obama administration, and so it dramatically changed healthcare in this country in two big ways. It created many protections for patients and consumers, and it also expanded coverage options that didn't exist before. So let's talk about the protections. Patient and consumer protections include the elimination of pre-existing condition clauses. So before the ACA or Obamacare or the Affordable Care Act, many people who had previously had diagnosed problems or diagnosed health problems were barred from enrolling in an insurance plan with an insurance carrier, which seems pretty odd, right? You'd think that someone who needs health care and support should be able to enroll in an insurance plan that will help get them that care and support. The other protection that was created was the creation of the anti-discrimination regulations on the basis of sex, which includes sexual orientation and gender identity. So this helps protect people who are seeking healthcare and healthcare to make sure that they are not in a space where they can be discriminated against because of who they are. So the ACA also expanded coverage options. It allowed children to be on their parents' insurance until 26. I remember when this news came out. And was super grateful to hear it. I had my own insurance coverage at the time, but I was super excited to hear that, folks who didn't have access to their parents or didn't have access to their own personal insurance could still be on their parents' plan up until 26. It also expanded Medicaid to childless adults. So before, unless you were with child, if you're a pregnant woman, disabled, or older or experiencing low income, you could not get coverage through Medicaid, which is the public insurance option. The addition of childless adult Medicaid meant that there was a category for everyone else who did not have kids. It created an insurance marketplace in every state to sell individual and small business health insurance plans. These plans are now regulated to be quality coverage that have to maintain certain and specific health benefits like emergency care, prescriptions, and mental health support. So why should you consider getting covered during this open enrollment period if you do not already have coverage? No one ever plans to get sick or to get hurt or to have to go to the doctor or the hospital. Most people are going to need medical care at some point in their life. So, this year it's even more important and critical to have access to affordable health care, given that we are, still experiencing COVID-19 cases, given that we're experiencing a monkeypox pandemic as well. So health insurance covers these costs and offers many other essential health benefits, such as emergency care, prescription coverage, mental health benefits, and the ACA also offers preventative care for free. So this includes things for coverage, or includes covered things like vaccines and screenings and some checkups for your healthcare. We all know that healthcare is expensive, especially in the US, and health insurance protects you from those unexpected high medical costs. DC actually has a really strong commitment to trying to get everyone covered by health insurance, and the district offers generous eligibility criteria for public insurance options. So Whitman-Walker's insurance team wants to make sure that everyone is aware of their options, and they're always here to help and work with folks who need to find insurance plans that meet their needs while maintaining affordability. Again, you can call them at 202-745-6151. Now, where do people go to sign up for health insurance? It varies by state, but it kind of depends on where you live. So if you're a DC resident, you can visit dchealthlink.com to explore your options. If you are in Maryland, you can visit marylandhealthconnection.gov. And if you're a Virginia resident, you'll need to go to healthcare.gov. Healthcare.gov is kind of the insurance marketplace for the US. You can also kind of drill down to which website that you need to go to, depending on what state you live in. And if you're confused or if you just need assistance with enrolling in a plan, it might be a confusing form. You can always contact Whitman-Walker's Public Benefits and Insurance Navigation team. They're happy to help. And again, you can call them at 202-745-6151. If you're on the DC HealthLink website, you can also connect with them under the Get Help tab. Again, they're available to speak with everyone and anyone about their insurance options and how they may qualify for financial help in reaching their healthcare goals. Thank you all for learning a little bit more about open enrollment and insurance navigation and the Affordable Care Act /Obamacare/the ACA /the marketplace, whatever you call it. And just be sure to get covered and put your health first in that insurance coverage way. But before we go, we want to give you a few reminders about the COVID-19 pandemic and vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step towards preventing yourself and your loved ones and your community from illness. Multiple variants of COVID have spread across the world, so it's understandable if you might want to keep wearing your mask, as the vaccine isn't 100% effective at preventing new cases of COVID-19, but it is very effective at preventing people from being sick with COVID or very, very sick with COVID, preventing people from ending up hospitalized with COVID, and preventing people from dying of COVID-related complications. So all that said, keep staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Please reach out to them at 202-207-2480 to make an appointment. And if you are in DC and looking for a vaccine location and we're not accessible for you, you can visit vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you are a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and be mindful of those who are around you, and just take some precautionary measures to discuss what other folks' precautionary measures around COVID are, but be mindful of masks and keep your distance, and especially when you don't know whether a person has been vaccinated or not. And on to monkeypox, because we're in two public health pandemics at once. According to the CDC, there are more than 25,000 cases of monkeypox documented in the US, And in DC, you can pre-register for a monkeypox vaccine appointment at dchealth.dc.gov/page/monkeypox. In DC, as of Friday, August 5th, walk-up vaccine locations are available from noon to 8 p.m. on Fridays or while supplies last at the DC Health Monkeypox vaccination clinics that are located at 3640 Martin Luther King Jr. Avenue Southeast in Ward 8, 7530 Georgia Avenue Northwest in Ward 4, and 1900 I Street in Northwest in Ward 2. If you live in Virginia, Virginia is working with local care providers to contact, trace, and identify those who are most in need of the monkeypox vaccine. And varying counties in Maryland are allowing residents to pre-register for a monkeypox vaccination, and the Maryland Health Department just released a pre-registration system. So please visit your local state's health department for more information on how to register and get vaccinated against monkeypox. In DC, walk-up vaccinations will be provided on a first-come, first-served basis to eligible residents who have not received a first dose of the monkeypox vaccine yet. You're currently eligible to be vaccinated in DC if you're a District of Columbia resident who's 18 years or older, and if you identify any sexual orientation or gender and you've had multiple sex partners in the past 2 weeks, including folks who are considered highest risk, who identify as gay, bisexual, and other men who have sex with men, transgender men and transgender women, or sex workers of any sexual orientation or gender, or staff of any sexual orientation or gender at establishments where sexual activity occurs, like bathhouses, saunas, and sex clubs. Please be sure to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check the website at www.whitman-walker.org for the most up-to-date information on Whitman-Walker services. And for more information on COVID-19 resources and general services, please call Whitman-Walker at 202-797-4439. You can also follow some of their programs at, or part of the Walker family and their programs at Real Talk DC _ and at No Filter DC. Have a lovely rest of your Friday, and take care.